Hi, I'm Ken Silverstein, the Chief Clinical Officer at Christiana Care Health System, and I'm joined today by Linda Lang, who's our physician lead of the Behavioral Health Service line here and also serves as the chair of the Department of Psychiatry. Also Bob Hansen, who's the Director of Addiction Sciences at Marshall Health in West Virginia. We're about to launch day 2 of the Addiction Medicine Workshop. Bob and his team and other leaders from healthcare organizations around the region are engaged in a 2-day conversation, learning a little bit about Christiana Care, innovative and effective strategies, but also sharing best practice in general about programs and strategies that are intended to impact those most affected by the opioid crisis. So I'm going to jump into some questions here. We know, I know that you are both deeply connected to the broad impact of this crisis. It affects pretty much everyone. So Bob, maybe you can tell us a little bit about what you're seeing in your community in West Virginia.
Yes, it seems that Huntington has been branded the epicenter of the opiate epidemic, and that's something that really concerns us in our community, but there's no question that we're in the middle of a crisis that is taking lives and impacting almost everybody within the community. I think we're also, though, gifted that we have some resources that we're putting into play to combat the opiate crisis. And I think first and foremost, we have great leadership in our community. Huntington is a city of about 48,000 people, and it's also home to Marshall University. And both the president of the university and the mayor of Huntington have been very upfront about the problems and also about potential solutions, and are trying to marshal as much resources that they can to address what's going on in our community. Our mayor is very open and upfront, and he speaks around the country talking about our problems, and he also speaks about our citizens and how resilient they are, and also he speaks about how he thinks that we're going to get through this, and then Huntington will eventually be showing other people in this country some real positive solutions and about how a community can get together and really make progress to address the opioid crisis.
Excellent, excellent. Linda, compare and contrast, can you say something about what similarities, differences to what you're seeing here in the Delaware community?
Well, the situation is really dire, and to add to what Bob is saying, we're seeing an increase in heroin mixed with fentanyl now. Fentanyl is 50 to 100 times more potent than morphine, and heroin is being mixed with fentanyl, so we're now seeing that more deaths related to fentanyl are surpassing deaths related to opioid painkillers and heroin. So the situation has really become worse. I would share with you that we have tremendous support and increasing resources from Christiana Care. We have built a multimodal treatment plan, which includes a Project Engage, which we'll talk about later this afternoon. It's an engagement specialist-run program that meets patients at the bedside. We have a neonatal abstinence syndrome program for our babies that are born addicted. We have a pathway that we've created to address withdrawal, opioid withdrawal, when patients come into the hospital. We have relationships with our state leadership to work on programs and legislation to help patients get the treatment that they need. We know that when we had the Accountable Care Act, patients were able to get into treatment, and now we're facing a situation where patients may lose that coverage. So we have people here at Christiana Care that are helping us connect with our state representatives to make sure that we continue to get patients the help that they need.
The advocacy piece. You mentioned the fentanyl-laced heroin. Bob, Huntington, West Virginia, achieved some national notoriety in 2016 when a batch of fentanyl-laced heroin resulted in 26 overdoses in a period of about 4 hours. So it was a real wake-up call, certainly around how this crisis can overburden healthcare resources. Can you speak to that and a little bit about how your community responded?
Yeah, that was quite a day, because you can imagine the weather, August, so it's hot and steamy and everything. To have that occur, we have one emergency response ambulance system in our community, so our resources were overstretched really for those particular 4 hours. It was scary, because everybody in town would hear nothing but sirens, one after another, as ambulances were racing to different scenes. And then just sitting down afterwards and seeing, gosh, what just happened? And one good thing that happened is nobody died. And I think that's a credit to our healthcare system, our 2 hospitals, as well as our emergency medical personnel. So, but then the other things that we looked at afterwards, there was a complete study done by our state Bureau of Public Health, as well as our local health department, to learn more, and fentanyl was obviously a key ingredient to what happened that day. But one of the key findings that really scared us is, we treated people, nobody died, but we didn't offer anything afterwards. So that was, for a lot of us in the healthcare community, and certainly working addictions, that was something that was really like a brick hitting you in the head. Here 26 people within such a short period of time in a small community were impacted, and they were revived, they lived, but we didn't offer any treatment options for them afterwards. So that was a wake-up call for us.
Sure. And a great segue to Project Engage. Linda,
Yeah.
certainly appreciative of your leadership and heading up, multi-pronged approach to this crisis in our community. Project Engage, really a cornerstone of that. Can you speak a little bit more about that and the impact you see it having on our community?
Sure. Project Engage actually began in 2008 here at Christiana Care. They were embedded in Wilmington Hospital first, and then at Christiana Hospital, and then moved on to the emergency room, and now we're expanding into the community. It's peer support. So peer counselors meet patients at the bedside who have come in with alcohol and drug addiction, and work with patients where they are to try and get them into recovery. We offer patients different kinds of treatment when they come into the hospital, and then we hope to get them on the road to recovery when they leave the hospital. And that can include medication-assisted treatment, it can include detox, residential, but they also do things like getting patients transportation, clothing, shelter, and one thing we've done recently, we found that patients didn't have driver's licenses, and they were not able to get into treatment because they didn't have identification. So we've been able to work with our community resources now, so patients can use their ID bracelet from the hospital as identification to get into treatment, and that has increased our ability to get them in. We have seen that we see 2,000 patients a year through Project Engage, and about 40% of them get into treatment, and 2/3 stay in treatment, which we're very proud of.
So it's really closing the loop, and I know that was part of how this relationship came to be, and certainly part of the genesis for this workshop was to connect around Project Engage. But you also know we're pretty deep on care standardization at Christiana Care. It's been a several-year journey. Maybe you could just briefly overview of the opioid clinical pathway.
Sure.
And its impact.
So we screen every patient that comes into our department through the emergency room and gets admitted to medicine for addiction. We use a screening tool that tells us that the patient is in withdrawal. We use a certain score. The patient is screened. If they are in withdrawal, we offer them a treatment modality to help them not go into acute withdrawal. The reason that we started that is because we noticed that patients were coming in with serious medical issues and leaving the hospital while they were acutely ill because they were in opioid withdrawal. We have now offered them a detox protocol, so they're not going into withdrawal. They can stay in the hospital and get their medical treatment, and then it gives us a reachable moment to have Project Engage come in and try and get them into recovery. We actually heard from a gentleman last night who had gone through our protocol, and he had been admitted with a very serious infection. He told us that had he not had our program, our opioid withdrawal protocol, he would have left. And now he's 7 months clean.
Oh, wow.
So it really works. We're seeing that patients are getting detox, and a large number of patients want to stay on medically assisted treatment. They want to stay on the medication and continue to stay clean, so we're able to capture them.
That's great.
Yeah.
Powerful, powerful story.
Yeah.
Bob, I know you had a tough travel day yesterday, but any brief snapshot takeaways from day one of the workshop?
Well, I think that the big thing for us in West Virginia and from our 2 hospitals in Huntington is we're committed to what you all have done here. It's very impressive, and I think just by bringing a team of 9 people who suffered about a 16, 17-hour day yesterday to come here just kind of shows our commitment. We have 3 physicians, we have a nurse practitioner and several administrative leaders here today and yesterday learning. So we think what you've done is fantastic, and we are looking to replicate as much as we can. And the good thing for both our hospitals is our top leadership is bought into the concepts and the programs that you've designed here. So I'm very hopeful in the next coming months, we'll be able to implement much of what we've learned.
That's great. Well, the commitment is obvious, and we really appreciate the opportunity for the relationship. Sure. Just like one last thought here, there are misperceptions certainly out there about addiction and about the opioid crisis in general. And for either of you, maybe Linda first, just what would you say you think is the most important for people in the community to understand?
Really, that addiction is a brain disease, and like any other disease, we have to treat it with the tools that we have, and we are working on implementing and discovering new tools to treat this terrible disease.
Any thoughts, Bob?
We still have a long way to go as a country, recognizing what Linda just said, and it's something we need to work on. That's part of our work has to be, we have to fit time in to educate the public about addiction and it being a disease, because there's still a lot of misperceptions out there in the community, and those misperceptions lead to people not getting the care that they need.
Well, I want to thank you both for taking the time to have the conversation with me. More importantly, the outstanding work that you are leading and really impacting your respective communities and quite pointedly saving lives. On behalf of Christiana Care, I'm deeply appreciative of the opportunity to collaborate. We continue to pursue our mission of being expert caring partners with our neighbors and serving them in health. So thanks very much for taking the time.
Thank you.